and Human Relations. Calling to order the Health Relations Commission meeting for January 4th, 2024. Sorry to interrupt our normal last Thursday of the month. We switched to the first Thursday of the month. Just to better accommodate holidays. So yeah, so we are all welcomed. I'm just gonna suggest, since we have visitors tonight, that we just go around and introduce ourselves, just the commission members. Y'all can introduce yourselves later if you would like. We'll start over with Tamika.
Hi, my name is Tamika Livers.
Hi, my name is DJ Walsh.
Scott Murphy.
Jane Stormer. Cammy Kelch.
Dave Bramer.
Right. And we have some other members that are not here tonight. Just a heads up and a reminder, if you are interested in being on the Health and Human Relations Commission, we now have a website and an application on our website if you would like to put your name in for our next round of cycling in new members, as some will cycle out this spring. So please spread the word for us. Our second agenda item is to approve minutes. So I'm going to move to approve our minutes from our last meeting in November. I'll second those. They're seconded. So we will call that approved. Agenda item 3 is time for public input. So really, if anybody is here for anything other than the sensory vehicle event discussion, and I think we have Lindsay here to talk about some updates for us about what's going on with the health department. So does anybody else have anything they would like to bring up for public input? Okay, and we'll have Lindsay chat with us when we're talking about action items, because she kind of falls into that, as inviting her to come was an action item from last time. Okay, so I don't see anybody who falls outside of those categories. So we can move on to number 4, which is sensory vehicle event discussion. So if whoever's here for that discussion, if y'all want to stand up, introduce yourselves.
I'm Mike Sims. I'm the chairman of Kindness Jefferson County.
And I'm Laura Wall. I'm a parent advocate with Kindness.
Okay.
So quick overview on what Kindness Jefferson County is. It was started as an idea by me that I called up a couple of friends, and I wanted to create a culture of kindness without politics, religion, or anything like that. We just wanted to show that people can be kind to each other. It grew enormously. And we hold meetings every 90 days, and we give away $1,000 to people that are in need. And the donations just kept coming in, and more ideas just kept floating around. And that's when Laurel and I and her husband were leaving one of the meetings one night, and we were talking about being sensory inclusive in this county. And so we got the idea, and we started talking about, well, wouldn't it be neat that if we had a mobile sensory area where we could take it to events. That way people could come to events, and our residents and then our visitors could come and know that there's a sensory inclusive event. So we shot the idea around, and we decided to ask for some grants from the Bethany Legacy Foundation and the Community Foundation. Laurel did a lot of research on an actual company called Culture City that's a nonprofit, and they actually make them. And lo and behold, we did it. So we received $85,000 in grants, and we now have the sensory activation vehicle. It's parked up at German American Bank. It is locked up, but if anybody wants to do a preview, we can meet you up there and let you look inside of it. It's air conditioned, it's heated. It has sensory items all over the walls. It's not soundproof, but it's sound dampening. And so what this entails is, when there's an event, the Lanier Mansion is going to be, looks like our first one. They asked us to come down for the Easter egg extravaganza. So that'll be a sensory inclusive event. when someone with PTSD, anxiety, autism on the spectrum, anxiety, disorders, if they get overwhelmed at the event by the noises or what's going on, they can come to us and come into the sensory mobile vehicle with, hopefully with somebody, you know, a family member or friend. And they can go in there for up to 20 minutes or so and re-regulate. There's beanbag chairs in there. I plan on putting a TV in there with sensory video, basically just very low volume and paint droppings coming down, just things that are soothing that can help regulate any anxiousness somebody has. So we will be there. Everyone that's there has to be trained. So we take 2 40-minute video trainings and then a video training on how to operate a sensory activation vehicle. So yeah, that's what it is. And it's the only one that we know of in Indiana, right?
Mhm.
In Kentucky or any surrounding state. So we're pretty fortunate in this community to have this, and this is free. So whenever there's an event going on and we want to make it sensory inclusive, we can have it there as long as we have volunteers to operate it. So you want
Yeah, I guess to piggyback on that, because we bought from Culture City, there's an app that they have that anyone can go on and access, and they can look up, like if they want to come to Madison or they're looking up Indiana or something, they can, we're not on there yet, but we will be, on that map to show what's available in Madison, sensory friendly. And kind of part of what I would like to see happen is more of our businesses or programming, Parks Department, maybe something like that, be willing to access that training, and then they can have their business, or the Parks Department or the government can have their business also on the map, and they will get that training. And part of that is, you know, hopefully getting sensory bags that are available in their business, learning about sensory programming for their business, and just kind of educating their staff and our community on how to be more sensory friendly with people who are on the spectrum, or like Mike said, who have PTSD or have anxiety, social anxiety disorders, things like that, just to be more proactive in how we respond to people and being more understanding, I guess.
On the trainings, Laurel, because you've been coming to the meetings pretty much, shortly after we started. I think Jennifer David had reached out to me and got you and I in touch with each other. So I know Outward Bound Services was working with you.
And they still are. So I guess I feel like there's two components to this. One
Right,
is more the sensory, the vehicle, and the using it for events and getting that training through them if businesses are interested. But also, Jennifer is willing to work on trying to start a support group, get that off the ground here in the county. And part of that would be with education, providing education and services. She actually has started that in Charlestown. So she's interested in bringing that here to just help us get it started. Because there's a lot of services I feel like families do not know about that they should, that would really help them, just like the BEADS program for people that are on the spectrum, or have other kinds of disabilities, that they can utilize, and it will provide them a lot of services. So I talked to her this week. She's still interested in working on that with us. We were talking about, where a location for that. So we're trying to brainstorm that. She also suggested a transition fair, which, she suggested the spring might be a good time for that, but she could help facilitate bringing a lot of service providers in that the community could access and come in for, and, just learn about what is available out there, and even if necessary, get signed up if it if they are not signed up for the BEADS program and they already have a diagnosis for autism, they could help them sign up for it. Things like that.
So what are y'all needing right now? Like you're still needing volunteers trained
Yes.
for the vehicle? Do you have a number or idea?
So we have 50 that we've paid for the training, and each volunteer, there's a little bit of criteria. There is a volunteer form that we have to have filled out, and we have decided to make, a background check. Something that, just a local background check. You will have to take the training. We can send the link by email, and you can do it at your own pace at your house. I actually liked it so much, I watched one of the videos twice, because I learned so much from it.
So the trainings aren't in person necessarily, it's just getting that volunteer form filled out and then your background check. If
Right.
you've recently had one or had.
If you've recently had one
last
within a
year,
year,
can I turn it
yeah.
into you?
Yeah, if you've recently had one within a year, that's
Several
good.
deals.
We, after the training's completed, then anytime you do volunteer at the sensory activation vehicle, we all will have a shirt that's blue that'll say sensory activation volunteer. And those are paid for by us. And the neat thing about it is the back of the shirt, we did a design contest and a little girl with autism made the design for us. So she got to put her name on that.
Mhm.
So that's a really neat thing. So yeah, the volunteers are what we're gonna need. We have limited volunteers right now. Anything new you present like this is kind of, people sit back and kind of wonder what it is until it actually gets here. I think once we have a couple of events, there's gonna be a lot more people that wanna be volunteers, because it's a cool thing.
I'm wondering too if something like, this is in the city and Madison Main Street, you run it, but like farmer's market, like a place where it could like be displayed, right? Maybe one Saturday and kind of draw some interest with that.
Yeah, it's just, anytime we have the door open so people can go in, we've got to have a trained volunteer there, because, we have to make sure that it's, on level ground. We have to make sure that all the safety measures are taken. But yeah, it would be great to display it for public viewing, to be able to come and look at.
Would volunteers be required to drive the vehicle
No.
anywhere, or is it just while it's stationary?
So the sensory activation vehicle is a 16-foot trailer.
Yeah.
And then.
I don't want to drive that.
Yeah. So we got a truck donated to us by Habitat for Humanity. So we have a 2010 Ford F-250 Super Duty truck that was donated. It's actually just got windows tinted. We had volunteers that Grubbs Automotive fixed what needed to be fixed on it. Super Shine did a complete detail and window tinting on it. Miller Automotive is going to put a new bumper on for us. Then it's going to go to Fiction Wrap, and it's going to have a wrap on the back of Habitat for Humanity. Bolton Construction on the tailgate. Kindness on the doors, and then Grubbs and Super Shine up on the front. So it's pretty neat. And then the sensory activation vehicle's wrapped too. It's got a black wrap with white lettering with Bethany Legacy Foundation, the Community Foundation, and Outward Bound, and Kindness, of course. So.
And part of the vehicle will be, we have a tent that will be set up so we can offer education, information at each time the vehicle is being used too, so.
Yeah, and we're gonna learn as we go along, right? I mean, we're a community and we want to have input, constructive criticism on it too, because we want to do it the right way that best suits our county. I've been, blessed in my job that, I'm an advanced crisis intervention officer in the state of Kentucky. And so I'm the one that does go to, calls where people need services and not go to jail. And recently we had someone on an aircraft that the pilot pulled back and said it was a disruptive passenger and they wanted him arrested. And I went on there and I was able to recognize that it was somebody with autism. And we were able to get the person off, no handcuffs, nothing like that. And I took him into my office. We shut the lights down, had another officer in there, and then we let him re-regulate. I gave him some squishy balls and we just talked. He closed his eyes. I mean, whatever works for, to help regulate. And we were able to do that. He was able to rebook his flight. And I talked to Delta Airlines and told him, I said, this is not a disruptive passenger. We just need to have extra care with this person. And once they realized that, then the whole narrative changed. So.
Well, I think, there's at least several of our membership within our, commission that are interested in the training. But I think a big thing that we need to kind of discuss in this meeting is how we can help, encourage or find volunteers, maybe strategize how to do that. And, I think we were talking about possibly even an event, like a call out event where we could ask people to meet. And I don't know if that's at our next meeting, to have a Q&A. We can publish that and, I don't know, put it on some Facebook groups. We don't have one, but I think the county has one. That has a pretty wide reach.
I think the volunteers need to be passionate about what they're volunteering in, and I would love to see school counselors or people in the medical field. Even city officials that may have a child with autism or somebody that has a family member with PTSD or traumatic brain injury. Laurel's a parent advocate. I don't really, except I have one relative that is autistic, but other than that, I don't. So I had to use education for myself because I don't have that experience, the real life experience.
A few things. Since we're a county commission, it's harder for us to like sway city officials. But I don't know if anybody has some strength they can pull.
Well, I think that,
That's
I
pretty big
mean, there is a city, HRC essentially, and we've got good rapport with members on that.
Put it out to them.
Put it out, we can talk to them as well. Madison Main Street's office is my neighbor, so I have good rapport, like, to live on Broadway Street. And talking to them about getting the word out to businesses. I know a lot of the Main Street business owners, and I think the second component, other than the vehicle that you were talking about, that's a good place, would be a good place to
Yeah.
start. with.
Anybody that has events, so like Visit Madison.
And
the
Mr.
Chautauqua
Forster's
group.
I had a meeting with him, and he's very interested
Oh,
in being involved in this, and,
Our mayor is too. I mean, I've talked to Mayor Courtney and he's really, I think, excited about this. He's gonna come to our ribbon cutting, which our ribbon cutting event is, February the 8th at 3 p.m. And, unfortunately, we are getting an office at the Venture Out. We're only able to hold 50 people in this room, so it is an invitation only for inside. And I don't know what the weather's gonna be like February 8th, so I don't know. But yeah, so we're gonna have a ribbon cutting. State Representative Zimmerman, he actually wrote a letter for us to get this. So he's on board with it. He's excited about it. He's coming down to come to the ceremonies. It's a matter of just getting it out there, letting the public see it and be like, oh, okay, this is cool. And, it's a really neat thing. I think we're gonna get more and more interest as we go to some events and people get to see it firsthand.
Yeah, that'll be your best recruiting tool.
Yeah,
Do y'all have a goal for how many volunteers you want before your first event? Because then you have a limit of 50, is that right?
yeah. So again, it's the newness. And I think setting a goal before our first event is just not worthy yet. I think we need to have our first event and let people come, because if you know we're gonna be down at the egg extravaganza, you all may think about that and go, oh, I wanna go see this. And you may look at it and think, okay, I wanna volunteer, this is neat. The biggest thing I want is consistency, that all the volunteers are consistent, because of course, people with an anxiety issue or something, they don't want, if they've been to another event and we did it differently this time, and now we do it differently this time, that's not consistency. So I would just want to make sure all of our volunteers are consistent with how we operate it.
Yeah, so maybe not even like having a formal event for recruitment, until maybe the need presents itself.
Yeah,
What's the way to go?
I would say let's have the event first, the egg extravaganza, and then do something.
It may just happen naturally.
Yeah.
Well, if y'all
Y'all
wanna,
want to partner with Jennifer on maybe on the support group idea and get some education that way and have the vehicle there too. So it would be kind of, we'd have the big vehicle there for that event and that would help bring in community members and bring in more education.
Yeah, and I think like it'd be good to maybe contact King's Daughters, Ivy Tech, and have a day where we go over there and let their nursing staff come, or their nursing students go and see it, or KDH, and let, you know, any doctors, nurses, or staff come out and see what it's all about. I think that'll really help us get volunteers.
I think Hanover College usually has like at least one home track meet a spring. That
It'd be
might
good
be
to
a
have,
good
yeah.
event to talk to
It
them
would be.
about being present out, to
Mhm.
spread awareness.
There was also a group of first-year students that very recently started a club specifically for accessibility. So I do know that there are groups of students that are really interested, and I guess I'm curious to know a little bit about what expectations you might have. So I could maybe either sell this as an opportunity or kind of answer questions that they might have about, like, you know, it's really important that volunteers are available during the summers because there's a lot of festivals during that.
And there is, I mean, right now is kind of.
Yeah, what is the volunteer expectation, or have you worked that out? Because like students at Hanover that are gone during the summer,
Yeah.
but they might want.
I think it's good to have, you know, volunteers from 18 and up. We want our younger people involved in this too, because of course we want our younger people to understand which, you know, the kindness thing, just the creating a culture of kindness and volunteering and helping. You know, I'd like to see some staff at Ivy Tech, at King's Daughters, be volunteers, the Main Street program. You know, that way when we do this, if I'm at work, we can go set it up and know that we have qualified volunteers to operate it. So, you know, and that's something again with the, you know, constructive criticism or, you know, constructive input. If we could get that from you all, if you have some ideas, please share it.
I think one concern that I might want to articulate is I do think that events specifically for showcasing are probably necessary, because while it'll be awesome that there's visibility of it at community festivals, I imagine if it's a need presents itself for it to be used, then touring it isn't necessarily something that would likely be appropriate in terms of de-escalating a person that.
Right. Somebody may need it if we're displaying it, and that's what we need to do is it needs to now become theirs
And
to be
so,
able to use it.
and so I guess that's just a thing that I might want to articulate is presence at those events will be nice and that will generate interest, but it also might compromise the ability for it to actually be showcased.
We can't
Yeah.
compromise the health and safety of somebody over showing it to people. So
Absolutely.
it's easy to say, okay, we're done. And this is their sensory room for next 20 minutes or so until they re-regulate, because that's
Yeah, and
what it's there for.
I think it would be separate, it's a your venture just from it showcasing it, but if, like the Easter egg hunt, that's probably gonna be, that's just because they need a sensory vehicle there. And while we would have information outside, if people were curious and interested, I don't think we would be letting them inside unless they needed to use it.
Absolutely.
So what we have so far is a 20-foot tent that's gonna be outside of it. We have a table, so there will be enough space for there to be information about health services or anything that's related to what we do. We've been working really close with Deanna Andrews-Smith with the suicide prevention. I actually helped her get that going, so they kind of want to be involved with us. And then, like I said, we went ahead and ordered 100 sensory bags. We still need to order the noise canceling headphones, so we're gonna be doing that.
How many can be inside of it? How many can you be serving at one time?
Just one.
Just one at a
I mean, if it's a family, like mom and child, or they can both go in it, but it would be only one.
It would probably not help somebody re-regulate if we put two different individuals in there. They're having two different issues, so.
It's really just a tool to use briefly, to re-regulate and then go back out and enjoy whatever you're enjoying, or sometimes they make the decision they need to go home, but, so, yeah, we wouldn't want anybody else in there with them, and volunteers don't go in either, they're hands off, they're really
We're
just.
just outside.
Yeah.
We're just letting them go in and use it. And then, of course, after they leave, there's proper cleaning that has to be done. So we have to have, proper wiping down of everything. And we'll have a checklist for all that stuff too, for our volunteers to make sure that we do a checklist on, got it cleaned up and everything. If you go on YouTube and you type in culture with a K, Culture City, sensory vehicle, you'll see a couple of different videos online that you can kind of see a little bit of how it is. They're kind of quick videos, but gives you an idea of what it is. It's gonna be a neat thing for our county. I think it'll put us on a map in a way.
Couple things, just as a heads up for our commission, if you're not on the Kindness Jefferson County Facebook group and you are on Facebook, I highly recommend, especially for the roles we're in right now. It's really, educational to see the needs that are being expressed by the community, so I'm just gonna plug that again. I think the only other thing, other than just helping you spread the word as you see fit, just let us know what you need us to do, and we'll collaborate. I think a big thing is to make sure there's like clear information about who to contact or how to start the process of being a volunteer, because that's really all I need to know.
That would be, so Laurel's not a board member, she's a parent advocate,
Okay.
but it would be me or her
Okay.
that you would contact Kindness Jefferson County at gmail.com. You can email your interest, and then I will email you a volunteer form. Once you fill that out, sign it, and email it back to us. Our board will look over the application and approve or disapprove the application. If it's approved, then we'll send you a link to the training. Once you do that on your own time, you'll get certificates you can print out from the training link. And then it's going to be our first time at the Egg Extravaganza. So we've got anytime you do something the first time, you're going to learn mistakes you made or things you can do differently. So again, we are a very open nonprofit. We love to have constructive criticism or just advice. And we have changed things in the year we've been in operation just by good advice from the public. So.
And as we work on the transition, like work with Jennifer on the transition there, or some kind of support group with education. I know one of the things we talked about is trying to figure out where to have that, what's a big enough place to have that. So that might be something that we can brainstorm together.
With us having the office that we're gonna get after January 10th at Venture Out, we do have access to the conference room. So there's a small fee, which we, if we can get the $25 or $35 fee covered, so we could host something like that. But we're very fortunate to get that, so. Right now, we're having some very expensive artwork made for the office, so we put a post out for all the Jefferson County kids to get your creative juices flowing, and we've already got kids making artwork for our office, so it's the best artwork you could ask for.
All right. I'll just say, stay in touch with us. We'll be in touch about trainings with anyone we think would be a good fit.
Yeah.
Including ourselves. And thanks for coming and chatting with us today. I don't think there's any need to make plans for a big event or anything based on kind of what y'all have already done. So if you see a need or a way that we as like representatives from the county can help out, just let us know.
Yeah, and if you get a chance, stop up at German American, you can see the outside of it. It's
I buy it, it's
pretty-
really good.
Oh, you've seen it? Good.
Oh, yeah.
Good. So yeah, and then, at the egg extravaganza, if any of you all can come down and check it out.
Do you know the date for that?
Oh,
I
March
have
30th, I think.
March, is it March
I
30th?
think so.
It's from 10 to 12, I know that.
It's March 30th.
You know what's really neat about that is one of our volunteers, this actually works at the Bethany Foundation. And that's really neat to have that collaboration there too, so we're fortunate.
We
Thank
would
you.
like to get Hanover College and I
Oh,
would
yeah.
get more involved. I know we've reached out, but if you guys have any contacts to help facilitate that, that would be amazing.
Work at both of them. I work
She
at
works
both
at
of them.
both.
Yeah, in the hospital, you know, the
Yeah.
hospital,
I
because
don't
I would
work
really
there.
like the nursing staff and the doctors to know, there's a doctor that works for Dr. Britt. She's very interested. I can't think of her name.
Nurse practitioner.
Yes, yes, she has a child.
Tina.
I didn't want to say anything because it's recorded but
Oh.
it's okay, but,
So have you talked about businesses, huh? Trying to get you out of this. You talked about businesses. Have you talked to the chamber?
you have,
No, I have
no?
not talked to
Okay.
Shane.
You're just trying to get other businesses involved. Maybe it's
That's a
getting
good
information
idea.
out at their meetings or whatever and just nothing big, but just.
Good ideas. Yeah, if you have ideas, email them to us because we, you know, we want to be a successful nonprofit. We want the SAB to be successful for our community too, so.
One other, I guess, plug is we're working on Special Olympics too, and we're trying to have a call out meeting separate for that. So just, so you guys are aware that we're trying to kind of bring that back to the county too and get that started again. And I have talked with the Madison Parks Department about that, and they're really interested in facilitating some programming for that as well.
Any other questions for Laurel and Mike?
Oh, I was gonna say, I'm happy to facilitate a conversation via email or with, my contact with the chamber. So like, I
Okay.
can start the email
Yeah,
with
that'd
you
be
and my
great.
contact on it to get you talking to them.
Okay.
Make that an action
Make it
item.
an action
Yeah.
item.
Yeah,
Okay.
and I'll see what I can do with Ivy Tech and TJ, do you want to do Hanover College? Okay.
That'd be great, yeah.
Thank you. Yeah, we appreciate that.
Yeah, there is a big bonus. I mean, if we get our businesses, you know, to take this training themselves, then they also have access to this, or they're on the app too. So that's just more people from out of county too, that they can look and say, hey, Madison's really sensory friendly and want to come here, so.
So yeah, if you want to download the app, it's free on, just type in again, K Culture City. And, there's an app that is pretty cool. I didn't even know about it, but there's a lot of places in Louisville where I work at that are sensory friendly.
And it's all over the United States, so.
Dr. Murphy, do you know anyone at the hospital who you could reach out to about getting involved?
I'm not sure who it would be, but,
Like a community
but
relations
maybe
person?
some, yeah, maybe a community relations person that I could reach out to as well.
I'll put that down as an option.
I didn't realize that was you sitting over there until you just said your name. Well, thank you all so much. If you're not on our page, get on the page and check it out. We are very, very strict on the page as far as being kind to each other. We don't allow people to, you know, disparage anyone. It's a pretty cool place to hang out.
All right, thanks so much.
On the Special Olympic side, Dow has a lot of, well, they have an event. It's either happened or it's getting ready to happen at Perfect North, so they help the ski Olympics, but they've helped other
Okay.
as well.
Mhm.
So I will, make some connections and see, maybe just figure out what they do or how they've done it. Most of theirs, even though that's in Indiana, most of it is on the Kentucky side, but, if it partners
Mhm.
with some of those things.
Yeah, that'd be great. And we need volunteers for that too.
Sure.
We'll make that an action.
Thank you all.
Okay.
All right,
Thank you.
Thanks, guys.
Bye.
Thanks. All right, so that is agenda item number 4, complete. Great conversation. Agenda item 5, commission members report on action items from last meeting. I wrote those down for myself, so I'm just gonna kind of lead us through those, if that's okay with y'all. The first one, and I'm gonna start with all my action items. They were to reach out, to Lindsay and also Lisa Shelton, about, the possibility of mobile clinics and kind of what's going on with their organizations. Lisa, if y'all remember, is a part of the group that's doing, kind of inquiry into starting a YMCA type organization in town, and I followed up with her. She said that Jane Williams is the person who's running their feasibility study through Triangle 2. And that their feasibility study is conducted in a survey format. And I'm just reporting what she said in her email. She said that it's a scripted set of questions, and people are contacted by phone through the survey. And there is a question in the survey that's not exactly asking about like a mobile clinic, but it's specifically asking if there would be support for free services at this center or YMCA, such as water safety training. So it does mention free services outside of just what like a YMCA traditionally we think of would do. And it's set up to allow respondents to add their other thoughts to that answer. So it doesn't ask specifically about a mobile clinic, but if it was at top of mind for somebody, they would have the ability to throw that in there. And she also mentioned that they're gonna reach out to us. We're on their list to have like one-on-one interviews with key community stakeholders. They said that they're gonna reach out to Dave Bramer. So Dave, look out for contact from Jane Williams.
So for Friday.
All right. Basically they'll be setting up a kind of a general meeting for that. So we can anticipate that in the future. Lindsay, who I reached out to about, the mobile clinic, is here today. And just to kind of give you context to the conversation we had, we had
Lindsay's with the health
with the
department.
health department, yeah. Our conversation was centered around different community conversations we had, with like, certain groups in our community. We had some kind of listening sessions set up in the fall. And we had little like, what do we call those? Breakout groups or.
Listening
I thought it was just listening session.
Listening sessions, yeah. It wasn't like an official HHRC meeting. It was just a listening session.
Subcommittee.
A subcommittee, yeah, that's it. Thanks, CJ. The words haven't always gotten to my brain yet after the holidays, but. So one of our groups was talking specifically about our immigrant community and their need for low cost clinic care for things like getting sports physicals at schools for kids, things like that.
Or first starting Head Start.
Yeah, we're starting Head Start. And that was a big kind of thing that we were wanting to follow up on to see if the health department was having anything in their plans to look into something like that, to have a mobile clinic visit our county.
Well, I don't think, I might be wrong, but I don't feel like you guys are probably gonna find the answer that you're looking for when it comes to free or reduced cost clinics. There might be a mobile clinic in the state, and I can look into that, and I will look into that. But I don't know if you guys remember, but there used to be, the pediatricians in town used to do the free physicals at the Madison High School for all students before going back to school. So everyone had their sports physical, and then they were all free most of the time. I think sometimes it was just a really low fee. And there were lines and lines of students from all the schools in the county with their parents, and you would wait in these lines and they would do your school physical and you would be out the door. Well, I don't know the name of the association, but the American Pediatric, they said no. And so this is not a great idea. And the reasoning behind it was because you don't have their patient file. I mean, listening to somebody's heart rate for small amount of time and a couple deep breaths and doing a really shallow, abbreviated look at their health is not in your best interest as a physician or a school organization or any organization, because you're signing off on these children's health when you really don't know, you don't have an accurate background of what health looks like for them. So you're putting these students at risk of having issues when it comes to sports.
Bureaucrats.
Medical.
So
bureaucrats.
it kind of put, it definitely caused the end of these, free physicals. And I am in the coaching realm, so I do know how difficult it can be to get the kids to get a physical in the first place, let alone without having, you know, a lot of access. And I know a lot of students are still going to urgent cares in places that don't have their histories on file. But I feel like with the decline of pediatricians in our area currently, we're probably not going to be able to rally the troops to get that done. I don't know about any mobile clinics that do reduced cost well checks or physicals, but I can look into it. I can ask the state if they have something like that.
I know that we had had discussions as well, and the health department was brought up at that time because of some of the new grant funding that, you guys will have. But not just mobile clinics for things like that, but also for,
The email talked about STD testing.
STD testing, HIV.
So we do
stuff
HIV, Hep C, chlamydia, and gonorrhea
on Wednesday.
on Wednesdays only by appointment. All of our, all of our medical related, services are by appointment. Most of our stuff is by appointment only, just because if you're there for food or septic, they're probably gonna be out doing most of their job is having them out in the field. So, but we do Hep C, HIV, gonorrhea, and chlamydia, plus treatments. So we do the treatment distribution if necessary. We also do all of the traces, contact traces for the county. So anyone that goes anywhere else and gets documented with a reportable, it gets reported to us and we have to do contact tracing. So we are in the loop. I don't know what kind of abilities we have to necessarily expand that. Because right now, we are using our Mondays and Fridays for the paperwork that builds up with the back-to-back appointments throughout the rest of the week. On Wednesdays, we also do our car seat. We have car seats. We don't have a lot right now, but we're hoping to change that for next year. Life Choices does the same for testings. I think that they were working at one point on expanding what they're testing. I'm not sure where they got on that, but they also do, I'm pretty sure, ultrasounds and maybe baby checks. So they are a good resource. We do have to refer people to them every once in a while, just for the sake of urgency on the patient's part. But if you guys have ideas on stuff like condom distribution or just family planning in general, that you have an idea that you want to be put out in the community, whether it's some sort of advertisement or just conversations, we're open to it. I don't know like I said, I don't know our ability to expand that right now, but
Do y'all currently distribute condoms?
we do.
Okay.
Yeah, we have people who come in
Is that free of charge?
free of charge.
Interesting.
Y'all have any events, or advertising already based around that?
We do not.
So my question is, how does the public know, other than like word of mouth? Is this on the website? That was my first question, like with the preventative maintenance of the, testing of the,
That's on the website.
so that's on the website. And then are there any other, ways that it's being announced, whether it be, I can't think of anything out there, like a flyer people's work. I mean, I can't think of anything right at the top of my head, but
No.
other than just the website and word of mouth. And then my second question is to go back to where we had originally talked about, which was the school physicals.
Mhm.
So since they don't do school physicals anymore, correct? Or,
It's not a community
Community.
school physical. I mean, the health department never had anything to do with school physicals. We do not, we don't have any practicing physicians on, like, inside. There's no diagnosis, there's no checkups or
Mhm.
anything like that that gets done at the health department. So we didn't have anything to do with that. But no, there is no like large community event
Okay.
wrapped around physicals.
so that's up to the parents, as far as their insurance and, to get that taken care of.
Yes.
And for like the parts of the community, like we were talking to the ones who can't get insured, because of like their, documentation status or something like that.
Their current work status.
yeah.
You know, so many people, have to begin working in this area as a temp. And that's for 90 days. So for 90 days, they don't have the insurance, and they don't have the insurance to get those things. Does the health department help any with those kind of things for the families or for the kids that want to do things?
Unfortunately, that's not something that we're really able to, reach into now. I can ask about funding for certain items, whether that's allowable under the health first funding. I don't know that that's something that we'll be able to do for this year, because the budget's already been set and, approved. But next year, the funding will be, to the full amount, so it will be doubled for next year, and,
Can you share some of what additional funding is allowing health departments to do this year?
it's allowing us to do a lot. There are limits. So we have been asked about mental health. There is a separate bill for mental health, so the health first funding does not cover mental health. But the aspects that they're looking for, this is not inclusive because there's a long list. But maternal and child health, trauma and injury, fatality reviews, substance abuse, that kind of goes into the trauma and injury. And then there's also like the childhood trauma and injury part. There's two different components there.
So how we, but,
You want to know specifically like what we're.
or tell me where I
what we're
can
gonna
go to look up this.
do? If you're wanting to know what we're specifically gonna do, we haven't quite posted it yet because it's all
Oh.
gonna come out slowly in
I gotcha.
contracts, advertised contracts. But I can share.
Is it like, yeah, thanks. Is it like, prevention of trauma and injuries and things like that?
Yes, I can share what some of the
Okay.
things we're planning on doing.
I'm just wondering, like, if for the future, I know that it's set for this year, if, like, children and youth physicals to prevent injury or things like that.
Yeah, that's what I was
If
saying. I can
yeah.
ask and see if that can be, if that's something that we can do.
That would be interesting.
Or just preventative maintenance. I know, not to make this like a huge conversation where we just kind of keep going out on the spectrum of every health thing that we think goes on in people's bodies. But one of the things that we had mentioned was about dentistry and how we do not have that in this area. So is that preventative maintenance, or is that covered currently with our health department, or do they assist? Whether it be just getting floss or fluoride toothpaste or.
So let's go with First, the youth physicals, I will ask to see how they feel about that and the criteria that they would have around it. I feel like they may or may not, approve that spending. It kind of depends. They're very big on, we definitely have to make sure that we're watching, insurance. We are contracted with several different insurance companies, so if things can be billed through insurance, they would need to be. And so I don't want to be funding people to be bypassing, insurances, even if they're getting services done outside of the health department. So, but I will look into that. And then the youth dental, there are mobile dental units. We have looked into it. We're not sure what the status is gonna be on that. Hopefully, if we can get a school health liaison like that, we do have two job openings for nurses.
Would this be only for you, or would it be for?
This would be for youth, what they were looking at to start with, because that's,
It's like 18 and under?
it would be school aged, so yes. And then I did put in an application to get, dental hygiene items. I don't know fully what that entails. We did it last year. We got them donated last year, from local dentists. That every second grader in the community got, a dental care package. So this year I did put in for additionals from a state, like a different funding source versus just having local dentists donate the same thing every year. So, hopefully we can get that done as well, but I haven't heard back on what we're getting. So while it doesn't cover everything, it does, hopefully if you can continue to cover second grade for a while, that's at least the exposure, because I know that right now they're not really getting as much exposure from what I understand in schools to dental health. So that's what they used to.
One thing we kind of discovered early on was that none of our dentists locally, except, was it Medicare? Medicaid or Medicaid? Medicaid. And that's a big
It's
problem
pushing
for a lot of people.
Yes, that's one of the big pushes that we had in looking for, what we could do. I mean, we can't do it all, but we can do something.
Yeah,
So,
because there will be money associated with that. It's just that we don't have a way to serve those people in this county, and so, getting a unit here would be great, but all of the costs wouldn't fall on y'all at that point, because a lot of
Yes.
people would have some funding behind that. We just don't have anybody.
So there are limitations to, some of the mobile clinics that would come in, and most of those limitations are that it is just a cleaning. It's just a cleaning and a screening, which is wonderful, but that's definitely a limitation, because when you're dealing with, oral issues, you're still gonna have to, depending on your insurance, you still might have to leave the county to get it taken care of, but at least you'll know that there's an issue and you would have had a cleaning, so.
They can plan for it.
Yeah.
Yeah.
Well, I think it's a start.
It's definitely a start, yes, 100%.
There's also I haven't heard directly, but I know that there are at least some folks involved in the YMCA effort that would like to see some sort of wellness center attached to that. And so that may cover some of these gaps as well. I don't know whether dental, but the reality is there's just a lot of gaps based on the limited availability of healthcare providers, and that problem doesn't appear to be getting better anytime soon. So.
We'll see what we can do. What we can do, yeah. Well, thanks so much. Does anybody else have any more questions for Lindsay? Sure. Do you have questions for us?
Yeah.
Is there anything that we can assist you in, or they help?
Not currently, but I mean, if you guys have ideas for things, we're open to it. You know, right now, we're just trying to start building programs. And you did ask what we were doing, so I can give like a really quick, I'll try not to be too long about it. We're partnering with WIC in Hanover. We've heard that there's some issues with transportation. We're gonna try to see what we can do to accommodate that as well, since it's not centrally located in, you know, the middle of the county anymore. We are gonna work with some nutritional programs. So that's really what we're gonna stick with to start with WIC, whether it's a program that's specifically with the breastfeeding mothers that gets them produce. And then we've also worked on something that gets a nutritional program for family outside of breastfeeding for each family group. And I think we're still kind of working on developing what that looks like, but the idea is that they would get a prescribed box of food that's gonna look very similar to each family, that if they attend or do nutritional, these nutritional courses once a month, they would get a voucher to go down to Tillo's to get a box of produce. In addition to their other WIC benefits, we're also going to partner for some trauma and injury prevention for infant and toddlers. So basically baby proofing supplies. And we are also hiring a health educator, which will work part-time at the local health department and part-time with WIC to just try to meet those needs. They're gonna help the school health liaison, maybe go into the schools. Their goal is just going to be basically community education and whatever that looks like. And part of that with WIC is just being able to go to a set location, maybe once a month, twice a month. You can count on somebody to be at a certain place to talk to you about your WIC benefits or whatever that might be, because there's a huge discrepancy in those who qualify for government insurance and those who qualify for WIC. They're usually the same, but there's a large discrepancy in those people who take either or versus both. And together, ideally, that's something that can really help change your health and wellness by having a better picture of wellness in your home. We are also going to be upping our car seats for this year. We've had a huge calling for that. We usually have a list of people that are on waiting and we just haven't been able to meet the needs with the grant that we have. So we're really hoping to be able to expand that this year. We're also working with healthy community initiatives with their wellness fairs and the substance abuse team. Part of the trauma and injury is substance-based. That is, while it's very closely related to mental health, that is something that is allowed under the Health First funding. So we can work towards trauma and injury prevention. So anything that's related to preventing.
And you'll be speaking at that next meeting. I just got an email.
Yep. So, and then there's some other odds and ends here and there that we're going to be doing. So, but that's the general gist of what we're starting with and hoping to expand on in the following year.
We'll keep top of mind, all of those things and how we might be able to help with it. And also how we can kind of help spread awareness of some of your programs and things like that, that it's just one of those things where it's like people know it's there, but it lays low. And so sometimes like getting reminders out like quarterly or something like that. I mean, we'll think on that some, how to help with that. But any other questions? Thanks so much for sharing.
No problem.
Maybe you can just get out, like you said, with the WIC information, just going to a place where people can show up and find out about it, because I think that's maybe not all the time, obviously, but there's a large part of the time that that's the issue. They just don't know. I mean, you run into it in veterans resources too. I mean, we have veterans at work trying to get, and veterans will come, but oftentimes it's their family members who had no idea. You really have that? Yeah, he does. I mean, all you have to do is,
Yeah.
just know
A
about
lot
it.
of
and-
people don't know what their
Yeah.
WIC benefits cover,
Government websites are not easy to get through, so that's another
they're
thing.
not easy to navigate.
I know. And so I can see young kids for sure, but people who haven't been around that, or veterans for sure haven't, you get started and you get thrown around, you're like, all right, I'm done. I'm not gonna do this, and they just walk away because
Yeah.
it's not worth the hassle, so.
And it would be nice to have information about the WIC program, even if they just know where to go to, whether it be putting it in certain factories. Most factories have a billboard.
Yeah.
Because myself personally, I didn't know there was that big of a discrepancy. And I bet there's a guarantee there's a great deal of more people that don't realize that either. Just knowing the different resources they can get to, whether it be at Kroger's or
Mhm.
Pride Supermarket, it's great at allowing you to put things there.
Mhm.
Very informative, so.
And reaching out to the kindness group, they have a huge membership
Mhm.
and they may be willing, and other kind of community groups
Mhm.
might be willing to post on their social media, different events and resources. And I think I saw them post the event you're gonna be speaking at. So that's one thing, just to,
And we just really appreciate you coming here, so you can let us know,
yeah.
so we can see how we'd be able to help.
The food banks, back to the WIC thing, and the food bank, if I've got to believe there are certain times food reaches its expiration date, and they have to get rid of it. And so what do they do? I'm sure they move a lot of stuff, I know, but maybe there's some things we can work with, 5 or 6 or 7 or 8 of them that are in the county, and have a kind of a central, point where they can just say, all right, we've got this available, and people know that I can go look here and,
Mhm.
like, next week they'll have these things.
Yeah.
Or,
Yeah.
that was pretty, when we handed out some ARP money to the food banks, a couple of them were in tears when we talked to them, so to help them that way was like, wow, we had no idea, we were trying to help, but to be able to continue that, get that,
The
Get the
food
food
banks
out
over
there.
here are very busy,
yeah.
so
Mhm.
I'm sure, but even using those as an event, yeah.
Well, just to let people know, okay, these, yeah, so.
Yeah.
You do have the website on your website, so she's got a link that maybe we'll flash it, make it big, and make it there, that do something that draws attention to.
Hopefully that'll be a nice partnership to come. We're putting a lot of resources into that and with kids, so we're really hoping that that's something that pays off for future health of the community. So,
Thanks so much for coming.
not a problem. Thanks, guys.
We'll let you know if we ever have any more questions, when I know what you're up to.
No problem.
You need another meeting than that.
I feel like I get my meeting quota met, but I'm more than happy to step in if somebody has questions, so.
Awesome. Thank you.
Thanks, guys. Have a great night.
All right, so that was my first action item.
Oh, gosh.
Went above and beyond on that one. Guest speakers and everything. My second action item was to do some research about translation services for the county. And I had a lot of notes on this because I kind of went down a rabbit hole, and I'm sorry I'm on my phone now, my computer ended up finally running out of battery. So I have my notes here on my phone. I think I want to, like, before I start on this, I just want to preemptively say that I know very little about like what we are doing in this county as far as, human services, because I have so much privilege myself. So I don't know, and I myself am an English speaker. And so I just don't know what we are doing. I don't know what services we have. But I just wanted to highlight some things that I found that could be helpful, and kind of show the importance of it. I got a little help from, the archivist at Hanover College with some of the stuff, which is interesting. Some of the things she dug up for me or that there are Indiana, codes for translation services, so I see 3445, 1.3, and DJ, I can email this to you if you don't want to type it out in the minutes. There is an Indiana code that every person who cannot speak or understand the English language, or who, because of hearing, speaking, or other impairment, has difficulty in communicating with other persons, and who is party to or a witness in a civil proceeding, is entitled to an interpreter to assist the person through the proceeding. And there's another one as well that kind of goes into more detail about interpreters, and how they're retained, and kind of how their services proceed, and if the court can decide if they're legitimate or not, and basically it goes on about that. There's also federal laws about it. There's 2 federal disability discrimination statutes for state and local law enforcement agency, through the Rehabilitation Act, Section 504. Basically prohibits recipients of receiving federal financial assistance from discriminating against individuals on the basis of a disability, specifically like hearing, and reading abilities. And then the Americans with Disabilities Act also kind of ties into this as well, with all state and local police departments, regardless of receipt of federal funds, are prohibited from discrimination based on disability. So we should at least, based on those things, have something in place. And like I say, I don't know because I don't have these experiences. But for the deaf and hard of hearing, there should be ASL services in place, just based on the federal laws. And within that framework, those services could be expanded to like language services beyond American Sign Language into translations from other languages. So whatever we're already using for that, hopefully we are, we might be able to expand. I don't know what those would be. We also found some resources. Courts.in.gov, that's a website, offers a search tool to find registered court interpreters. So people who have already been registered as court interpreters
Which are required to pass proficiency tests in
Right.
order to do that.
so
You can't
they're
just like
certified.
be your, it's not supposed to be like, say your parent is in court and the kid like is interpreting, they're supposed to have.
They take an oath and everything, and are supposed to be impartial, that sort of thing. So there's a website for that. So there's already a resource existing in that. The Department of Justice outlines the issues of language barriers, cases, and resources in a document that I found, that Jen DePlage found, the archivist at Hanover College. I'll share that with DJ, so it'll be linked in our minutes. There is lep.gov, language English proficiency.gov is specifically about that. That's a government website about this issue. And some other things that could possibly follow up on. Columbus, Ohio, their 311 number has a translation service attached to it. So you can just call 311 and ask for a translator, which I thought was really interesting. There are, different services out there. I have no idea which one's the
Out
best.
if we, I mean, as far as, I've also never had to use them. Interpreter services in our county for myself.
Yeah, Costa Mega through OBO does translation and education and services.
So it's limited because that was one of our listening sessions was at Casa Amiga with
I know
Shirley.
RPR was doing part of that too.
So I know she's not always available because she's pretty much,
Yeah.
seems to be the only one in around.
Mm-hmm.
So, I know our group had talked about, um, when I went to the hospital, and I don't know if they still do this here, but we had like iPads on wheels that we could bring into the room, and you would basically FaceTime with somebody for whatever language, whether it was sign language, Spanish. I had Indonesian family before, like, and you could pull up the interpreter.
I've had.
And that was nice because it was because of the ASL aspect with it being a FaceTime rather than a phone call. Like a lot of language lines do. I don't know that our county has anything else other than the access to a Spanish speaking interpreter in Shirley. I know prior to the, iPad system at KDH, it could take hours to get a certified ASL interpreter to the hospital. And so because I am fluent in sign language, the hospital would pay me time and a half to come in and interpret until a certified interpreter could get there. So that there was at least some way to communicate to a mother who needed to have her baby that day and wasn't expecting to, or, you know, whatever. Same at the
Use,
jail, I've never seen like a
so they
ASL
do
interpreter.
encrypted scan trial at Madison State Hospital, and I know that Dr. Reeves, like video calls an interpreter because there's some language barrier. There's like 2 deaf patients and someone who speaks zero English. So I know in order to do her ICST with the patient, and it's a video call. So if they have to do ASL or another language, and she, like 5 minutes max is the most that she waits. So I could always forward you out, I can ask her who she uses for that and forward that to you.
Yeah, I mean, I think it would be great to at least get this information to our county officials as something to, I don't know, look into how we handle, making sure that communication is accessible to all, whether you're coming in to pay your tax bill and have questions, or whether you have gotten a speeding ticket or, been arrested or going to court, just, but that our county offices have access to speak to people.
There is a company I found, and I have no idea if this is the best one. I'm sure there's several out there. One called Voyance Interpretation Services, specifically work for 911, EMS, fire, law enforcement, education, health and human services, so organizations like that. So they specifically work with government industry or agencies to serve them. And it just made me think of like, you know, calling 911 and not being able to actually communicate because there isn't a translator available. So I don't know if we have that kind of service with 911, but it just seemed really scared to me in that moment because I used to travel abroad a lot. And I had a health scare at one point abroad. And I was like, I don't know the number for 911 here.
Oh, yeah.
Oh my gosh, and if I called it, would they even understand me? So that's like a big thing we need to be aware of for the people in our community who live here or who are visiting is to be sure to kind of put that information out there that we do have language services once we do get them in place, if we don't have them already, because I don't know what we do and don't have. So that's the main things I found. I'm sure there's lots more. I thought I kind of stopped there because with not knowing what we already have, I just didn't think it made a lot of sense to dig too much deeper because we just need to know more. But I think it should be a priority just because there are so many state and federal laws that kind of surround this. It makes sense to move forward with it. And I know there is a lot of focus with law enforcement right now, on topics that are connected, to, basically communication. So I'm just making sure, I think I want everybody to be equitably served in all kind of aspects in our county. Whether they're calling 911 or, through fire, and that's been a big topic lately. and Health and Human Services, so. Any questions about that or input?
Thank you for that research. That was a lot.
I'll share with you the links, so we can look at the documents. There's the government documents I found really helpful in kind of summarizing the issues and, how compliance has been a challenge with this in particular, nationwide. Okay, that was action step 2 for me. I think that's all my action steps. The other action steps were, today to look into making an email for the commission.
You know, we're switching emails. I thought it'd be finished by now, but it hasn't. So it's gonna be supposed to be the end of this month. So once we get that switch, there's no sense giving them one and then having to turn it. We'll get one here. But still working on that.
Okay.
Then I had another one about the fire hydrants. I've reached out to them. I haven't heard back yet, but I'll keep after them to get some information.
Are all of our fire departments on a volunteer basis?
Mhm.
Is that something that we see like continuing in our future? I know we've had a lot of like industry and economic growth. And if that's something, if we're looking into forming a fire department that's not volunteer based wholly.
I mean, the county just passed the increased public safety tax to pay to help increase funding to volunteer fire departments, so we don't see anything on the horizon to pay it. Usually that would be in the city,
Yeah.
you're gonna have a paid fire department, but I think
They
there
do a
are
great job. That's in their
5
work.
or 6 in the city and then 8 or so out in the county. So-
Yeah. I was just thinking that
15.
we were talking about education and outreach and things like that, and that would be a lot easier if you had people who were like on salary to do those things rather than a volunteer basis, but
Well, I mean, most times the volunteer firemen are very, very passionate about what they're doing, so that's not a big hurdle for them to overcome to go talk to people about fire prevention. So,
And they're pretty good at that. They do a really good job of going to the schools
Mhm.
and especially to the grade schools
Mhm.
and allowing the grade schools to know, the kids to know, do you have a outlet? Do you know, have you and your mom and dad practice how it's safety for this or so therefore for what we have and for our area, they're very proactive. I mean, they're extremely proactive.
They actually, participate in the annual residence hall fire drills that happen and literally witness every residence hall room on campus so they can get familiar with how they're laid out.
Well, only one iron. But I get it. But I just was asking because I'm like, we have this huge hotel now and, yeah,
And they're really
really
active.
big structures.
Say another great thing is that they're very active in the community in general, which helps immensely because they are employed in so many of these different larger, because Madison's always had large structures. Those hotels were just built from a different factory,
Right.
so they were already a factory. They're probably a bigger fire hazard when they were a factory before they were a hotel. They were a much bigger, sure, they probably were a bigger hazard than that.
Well, they were big at building.
Yeah.
Yeah, there were just less people in the vacant building.
Right.
All right, the other action step I had listed was for all of us to visit the website and check it out.
I'll be back. I looked at it on a mobile
Uh-huh.
device and I realized that if you like Google Jefferson County HHRC, the responses that you gave for the FAQ is like the top result.
Ah,
But if you go there, it is hard to make it back to the page.
Okay.
Because in order to find the HHRC page, you have to like dig into it. So my only recommendation would be a 5th question that is answered, just like how do you connect with this group if you have things that might push them back to the HHRC page on that site.
we can make that an action step for me.
Yes.
Okay. I'll reach out to Sarah to see if we can add one more, so it gives that prompt to direct us back. All right. Oh, man, this is hard to do on my phone. Gotta get back to her.
The next thing on the agenda
Yeah.
was, commission members report on any new business.
Any new business? All right, I see no new business, so we can move on to our next meeting dates, which will be February 29th, March 28th, and April 25th. Is anybody seeing any conflicts there that they can? Not yet.
Get the room booked to the rest of the year on that Thursday.
Okay,
And then if we need to change it, we can, but that makes sure we'll have them set up.
okay,
So I'll pass it on.
all right, and I'm gonna do better of letting Sarah know when to change it on the website.
I got to her though,
Good.
and she got it changed on the website, yeah.
All right, DJ, can you share with us the action items for the next meeting?
Yeah, I need to find a point of contact at Hanover College, connect with Kindness Jefferson County. I have Jane will find a point of contact at Ivy Tech to connect with Kindness Jefferson County. Cami will find a point of contact at the Chamber of Commerce to connect with Kindness Jefferson County. I have Scott will find a point of contact with KDH to connect with Kindness Jefferson County. And then I can Jane will work out if there's questions with Q&A that redirects to the HHRC website.
Okay, awesome. That sounds good. We will follow up on those on February 29th at our next meeting. I'm going to move to close this session.
Second.
Okay. We got a second, so therefore we are done for today. We will see you on our February date. All right.
Thank you.
Thanks for coming.